Hello, I'm glad you could join us today. Welcome to the webinar Questions of Legality and Ethics in Behavioral Health Marketing. My name is Angie Fiedler Sutton, and I use the pronouns she, her. I'm with the National Behavioral Health Association Providers. The National Behavioral Health Association Providers, otherwise known as NBHAP, is a national trade membership association for providers that provides education and advocacy for behavioral health care providers and related entities. We are the leading and unifying voice of addiction-focused treatment programs. We provide membership benefits such as networking and access to compliance information, educational opportunities such as this webinar and our certificate in addiction treatment marketing, the CATM, and advocacy efforts to keep those in the industry aware of new laws and regulations that may be coming that will affect them. Working in the behavioral health industry or managing an organization in the industry can be incredibly complex and filled with ever-changing information. NBHAP gives you the resources to stay on top of the rules and regulations for your organization to stay compliant. For more information about NBHAP, you can visit our website at www.nbhap.org. And now, it's my pleasure to introduce our presenter today. Nick Jaworski has helped build startups across the globe from Turkey to China to the U.S. A passionate recovery advocate, he sits on the board of Above and Beyond Recovery Center, as well as advising the National Behavioral Health Association providers. Through strategic marketing and operations, Nick has helped several companies start from humble beginnings and grow to multi-million-dollar-a-year organizations. His expertise drives results for all of Circle Social's treatment-centered clients. Circle Social is an associate member of NBHAP, and members can get a free analytics analyst of current marketing efforts as a benefit. You can also hear Nick on the 26th episode of our podcast, Destination Change. Nick, thank you for taking the time to present today. With that, I will hand the webinar over to you.
Thanks, Angie. I appreciate it. So today we're going to be looking at legal and ethical compliance. This is part of a broader healthcare executive course that we offer. Just a heads up or a disclaimer, I am not a lawyer. This is not legal advice, but obviously we get a lot of queries from clients, big and small, around both the legalities of marketing within the behavioral health space and healthcare in general, and also the ethics of it, which are usually overlapping, but not always quite the same. So I'll address both legal and ethical aspects of marketing with this in this space. We'll do a pretty heavy emphasis related to online marketing, which tends to be a lot of people's questions, but we will also address in-person things like community outreach, business development, commission-based pay, that kind of thing. So with that, we're going to kick her off. The number one question that the vast majority of providers have is HIPAA compliance. That's really what they're looking at. HIPAA compliance is fairly easy from a conceptual standpoint, but it actually is difficult to manage once you get down to the nitty-gritty, and there are various liabilities that arise. Most organizations are on some kind of spectrum. HIPAA is not overly specific at times, and so there can be a lot of gray. If you're speaking with legal counsel or compliance, they are generally going to have you on one side of the spectrum where we're trying to take absolutely no risk whatsoever. And then on the other side of the spectrum, you might have individuals say, well, that's too costly to implement, or that doesn't really make sense for us. I'm actually going to give you some examples for some healthcare providers, Cerebral being a really good one in terms of where you can get tripped up by operating a little bit too much in the gray. So when we look at HIPAA compliance, super simple. All we have to make sure we're not doing is mixing PHI and PII. PHI is personal health information. That would be anything related to someone's medical conditions, any diagnosis that they have, any disorder, and their personal identification information. So personal identification information is anything that connects to them. Name, phone number, social security, insurance information, IP address on the computer is a really big one. But anything that's identification information. If we have those two things separate, we are not in violation of HIPAA. So if we are talking about an individual and we have their name, we have their phone number, we have their email address, and we're using that for marketing purposes, if that's all the information we have, that is only personal identification information. There is no health information in that list, in that communication, what have you. So we are perfectly fine with using that for marketing communications, or even potentially using it for retargeting, which we'll talk about later. But it becomes a problem once we've mixed that information with any kind of healthcare information. So again, if we have a diagnosis, if they're seeking treatment for something, then that creates the two together and we have a HIPAA complaint. The other thing to remember with HIPAA is that we are supposed to self-report. So if you are aware of a HIPAA violation, generally you're not going to have any action against you unless somebody reports it. So unless a patient feels or finds out that they've been violated, or an organization, you won't see that come across, but you are required to report it yourself if you find it. And so self-reporting, if you do not do that and it's later discovered, then that can be a much more serious fine, much more larger legal issues. When do we start getting into some of the nuance and complexity within PHI? Again, that sounds so simple, right? Just keep the identification information over here, keep the health information over here. If we're going to put those together, they should be in a HIPAA compliant, secure environment like an EHR. Images is a really common one, especially in the marketing world. You have lots of people walking around taking pictures of your facility, taking pictures of alumni programming, perchance, and that can be a HIPAA violation if we've got the picture of a patient or even the outline of a patient. So according to HIPAA, if it is a resemblance of an individual, then it is a potential HIPAA violation. So even if you see the back of someone's head, that can be a concern. We always just want to be very careful. Look at any images we're posting online, any images we're adding to email content, and that they don't have images of patients or former patients in them. You can get a HIPAA waiver, and so you are able to use testimonials. That's a question that we get quite a bit, actually, is like, well, can we even use patient testimonials? Yes, absolutely. But they need to sign a HIPAA waiver saying that you are allowed to use their likeness and image and that you will be mixing PHI with PII in those communications. And so without the waiver, then you would have an issue. Lists, like I just mentioned, is another really common question. And again, if we don't have healthcare information in the list, then it's perfectly okay to use that information, for example, for marketing purposes. I can collect all of our patient data. I can pull their names. I can pull their emails from the EHR, and I can send them communications. And that is not a HIPAA violation in any way, shape, or form. However, it is a violation if a third party comes across that information and they learn that they were a patient. And so that would have to be communicated from the organization. And I'll give you an example here, was Cerebral. So part of the FTC's lawsuit against Cerebral had them mixing PHI and PII. Cerebral had been quite careful. They had kept everything separate. And so they were creating a retargeting list on Facebook. So most people, if you're in the marketing world, you know that you can create what's called a custom list. You can do names, emails, lots of different personal information, upload that into Facebook. Facebook will attempt to find those people and allow you to market directly to them. Here, technically, we still don't have a HIPAA violation because we've only uploaded PII. Now, we can have a HIPAA violation if we start to mention healthcare issues. So if it becomes too clear or too obvious that we were marketing them because they were on our website searching for treatment, or because they're current patients. And if we sent out a message that said, are you a former patient of our program? We have a wonderful alumni event coming up that we think you should sign up for. That would be a HIPAA violation. Now, where Cerebral got tripped up, it was just a conversation slip. So they had some low-level marketing individual talking to a Facebook rep. Facebook and Google call you all the time. They're always trying to get you to spend more money. And so they'll walk you through your accounts and talk to you about things. And this individual said, hey, we have this custom audience that we uploaded. It's a list of our patients, and we're trying to retarget them. Right there, that was a HIPAA violation. Because even though the list was just PII, just personal identification information, that individual working for Cerebral mentioned that it was a patient list, and now we were mixing PHI and PII. And so now we have a HIPAA violation. And the FTC actually got a hold of that recording, because Facebook and Google tend to record all their calls, through a subpoena, and then used it as evidence in Cerebral's lawsuit and judgment. So you can see here where, while it sounds really easy and simple to keep these two things separate, just really little slips can land you in pretty hot water. Even if you had named that list, what if you had named the list patient list? That's the terrible idea, because now you're identifying that these are patients on this list. And if you emailed it to the wrong person, if your email got hacked and it got stolen, or if you had someone slip up and mention it as a patient list to someone outside of the organization that's not covered under a BAA, then you are in violation. Reviews is another one that's really common for people asking questions about. We get online reviews all the time, and the patients or the family members are voluntarily sharing this information. Here is one of those areas where it's a gray issue from a legality standpoint. There are no case law examples that I'm aware of that says that, okay, if you respond to a review to someone that's already gone and publicly given that information away, that you are in violation of HIPAA. However, in taking that really kind of strong perspective from a legal standpoint in compliance and just being safe around liability, we strongly recommend against confirming or denying that any individual has been in your care. This is hard for providers because sometimes we get negative reviews, and sometimes those negative reviews are false or they're inaccurate. And so we obviously want to defend ourselves, or on our end, defend our clients and say, okay, we're aware of this issue. This is not what happened. Here's what happened. We can't do that because that is going to then confirm that that individual was in our care. They've got identification information, which is their name tied to the Google profile. And so we're not allowed to do that, to be overly cautious. What we strongly recommend instead is, unfortunately, a really generic templated response. Due to HIPAA compliance concerns, we were unable to confirm or deny that an individual has been in our facility, but we take these concerns very seriously. We strive to provide the best care possible, and if there is a concern with our services or anything else that has happened under our care, we recommend that you reach out and contact us at the following contact information. That is usually the best way to respond to a review. The same goes for a positive review. Even for a positive review, technically, we should be cautious and not confirm or deny that that patient was in our care. We tend to do those a little bit differently. So we will recommend that you can respond to the review in a really generic sense. So let's say a patient says, hey, we're really happy with the treatment that we received for our son. You can make a response saying, here at our treatment center, we work really hard to provide the best care for everyone that comes into our facility. And we're really happy that you were willing to leave this comment. So you'll notice in that response that we neither confirmed or denied that that was an actual patient. We're just speaking very generally that we're happy for this kind of feedback, and we're happy that we're delivering or quality care is something that's being seen by other members in the community. Emails. This goes back to really the lists, the question we get all the time. Hey, can we email our patients? Can we email a marketing list? If we have a sign-up form on the website for a newsletter, can we send out the newsletter to previous patients, to family members, to people that sign up on the website? Absolutely. Again, if there's no patient information or there's no healthcare information being disclosed in the email, you can send as many emails as you want all day long. Not a problem. Website analytics is becoming a larger question mark. And if you are in the broader healthcare environment, a lot of hospitals, for example, have decided to go the route of just being really, really safe and not even allowing any kind of tracking or analytics installed on the website, including Google Analytics and Google Search Console. So if you are in the marketing space at all, almost every website in the entire world has Google Analytics installed on it, or GA4 as the current iteration is called. These are free tools provided by Google, and they tell you things like, where are people coming from in terms of what cities or what states? What pages are they visiting? How much traffic do you have? Now, you'll notice in all of that data, there's really no personal identification information whatsoever. At the closest that you've got is maybe city information, but that's not enough to really identify a particular person. So for the most part, Google Analytics is not a large concern to have installed on your site from our perspective, but it's still something that hospital systems in general are starting to take a more cautious approach to, and it's worth looking at as a behavioral health provider. Now, one of the reasons that hospitals are much more likely to take a more conservative approach is in the difference between an authenticated and an unauthenticated access to a website. When we talk about authentication, this is a situation where we are tying a user profile to a website. So this could be an online payment portal. This could be an online patient portal. This could be even a community partner referral portal. Maybe you have a portal on your site to send referrals and make it easier for you to get that information. Now what's happening is we're getting a mix here. We have login information, which includes some username, usually an IP address for security purposes. That profile likely has a lot of patient identification information on it. And especially if it's a patient portal, it's clearly identifying that they're a patient. So the way that these analytics work is they send data back to these third-party providers. You send data back to Google. You send data back to Facebook. You send data back to LinkedIn. And most of this information is hashed, it's anonymized. And so it's not really, you would never be able to find that information and tie it back to a person. But when you're looking at government entities like the FTC, they don't really understand all the technicalities of how this technology works. All they know is that some patient information and identification information got sent to Google or got sent to Facebook. So you're opening up, you're opening up a serious liability risk just because some of these government agencies don't really have a clear understanding of it. And then again, there are situations that we don't know, right? Maybe Google does have a database of all this information coming in that's accessible somewhere, and that is going to create a HIPAA violation. Like, we don't know what Google's doing. We don't know what Facebook's doing. And so to be ultra safe, whenever we have an authenticated website, meaning that somewhere people are logging in and then creating a user profile, we do not want any data whatsoever being sent to a third-party provider. So if you have authentication on your website, you should absolutely remove any tracking tools, including Google Analytics. With advertising, when we talk about Facebook, TikTok, LinkedIn, etc., even your connected TV ads, if you're doing CTV ads, a lot of that data gets pushed back to a provider through what's called a pixel. And that pixel tracking can be used for data analytics. It can be used for retargeting. So we identify an IP address, and then we will resend a follow-up campaign to that same IP address. Or we'll attach a cookie to a user profile on Facebook, for example, and we'll be able to send a secondary follow-up message using retargeting. It's really, really common in the vast majority of the marketing world. That's why all these ads follow you around all the time. That's why if you click an ad for addiction treatment, suddenly you get 7 more ads for addiction treatment from different providers popping up. These platforms are using their algorithms to create targeting situations. That is really something that you want to be super cautious of, and we strongly recommend against. So most platforms don't even allow it anymore. Facebook will not allow a healthcare provider to have a retargeting pixel. Google won't allow a provider to have a retargeting pixel on the website. So their terms of service discourage that. Now, it's not technically illegal because, again, they're hashing this data. And so there shouldn't be a HIPAA violation unless you're doing something like uploading a patient list that says patients on it, unless you actually go in and mix that or have a conversation with a Google rep that you tell them it's a patient list. So there's not a legal issue there, but there is certainly a very, very serious risk. And then again, the terms of service don't allow it. So there's no real point in having retargeting pixels on your sites from any of these platforms, because they're not going to allow the pixel to send the data back anyway, because they're concerned about the liability on their side. The last one to look at in terms of HIPAA compliance is an online form fill. This one is one you definitely have to be careful of, and an area where a lot of providers have concerns. When you look at an online form fill, most providers have an insurance verification form on their website, or they'll have a contact us form. And in that contact us form has personal identification information and usually a comment box, like tell us what's going on, or what do you need, or how can we help? Now, most of the time, the person filling out that contact form is going to provide health information. They're going to say, hey, I'm looking for treatment for cocaine addiction. Hey, I'm looking for treatment for severe depression. So now we have electronic data being sent that's mixing PHI and PII. If that's intercepted, that would be a HIPAA violation. So there's nothing wrong with collecting and sending that information through the web, through the internet, right, to get to your servers. But there is the risk of that being intercepted, or maybe someone makes a mistake when they're coding the website and they send it to the wrong email address. Lots of different things could happen there. Ideally, in that world, what you want is double-end encryption. And so HIPAA has higher standards of encryption for electronic transfer of information, particularly websites, than you would need for a standard regular website that's selling whatever, clothing, for example, e-commerce. If you have that on your website, we strongly recommend that you talk to a security firm. A marketing firm's not going to know how to do the really complex levels of encryption needed. to ensuring compliance, you definitely want to have a chief technology officer, chief information officer, or a third-party security company reviewing that kind of linkage for you. So online form fills are something to be very careful with. You can eliminate that risk just by deleting the comment section. So they type in their name, maybe they send insurance information, that's fine because that's just personal identification information, but you don't have a comment in there, so you're technically not mixing PHI. Most providers don't want that. Most providers want to know why people are trying to contact them, and most people filling out a form want to be able to provide some context and some information. So for that reason, we strongly recommend just having that content box form overseen by a compliance company that really supports HIPAA compliance. All right, moving into illegal activities, what are some major concerns that we have in terms of the way that we are dealing with marketing situations in particular? So the Stark Law is one that's really common in behavioral health that we need to be aware of. This is a law that a physician or someone that owns a practice is not able to refer to themselves. So let's say that I'm an active physician and then I also own or am a partial owner of an addiction treatment provider. I cannot refer my patients into my own program. That's a very serious concern from a legal standpoint. Same thing if a family member owns it. So I can't refer into a program that's owned by a family member because that was a way that people try to get around the law. You saw this used a lot with labs. So the kickback laws and Stark laws were used when there was a lot of referral relationships between labs. And so for urine screens, an addiction treatment provider in particular would run a urine screen, or they would refer a patient to a lab for a urine screen, and there was all kinds of reciprocal payment relationships. You see it a lot with sober living or transitional livings as well. Those are illegal relationships related to the Stark law. And we also have kickback statutes. Kickback means we can't incentivize treatment, basically. This can be paying for a flight. This can be offering a free meal. This can be offering free services. Anything that is incentivizing a patient to come into treatment above and beyond the care that you provide is a concern. Now, technically, this law only applies to providers that take federally funded insurances, Medicaid, Medicare, but also applies to providers that take any kind of military insurance. So TRICARE is a military insurance, and so if you take TRICARE, as most providers do these days, you need to abide by anti-kickback statutes. Additionally, I always strongly recommend to providers that, hey, look, if this is what the federal government wants, probably a good idea to follow that regardless of what insurance types that you're taking. This is an area where it's really better to be safe than sorry. And there has been a lot of conversations around engaging anti-kickback laws for other kinds of insurance as well. So you have to be very, very careful, make sure that you're not offering any kind of free services or even something like like I said, a gift card or a meal ticket to come into treatment. Now, once they're in your care, you can provide various incentives for things. You can recommend that people download an app that you're providing them. You can provide food while they're in your care, right? That's fine. But it's on the front end, if you're focused on marketing any kind of free included services outside of the treatment being offered, that you're going to run into anti-kickback statute concerns. Related to that is waiving deductibles and copays. This one used to be fairly rampant in the field. Sometimes I would get providers that would say, well, these people can't afford treatment. And so we're going to try and collect the deductible, but if they don't, we understand. That is not legally tenable. And so there have been numerous court cases where insurance providers have gone after healthcare providers to show that they have not made a real significant effort to regularly collect deductibles. I don't remember what the benchmark was. I was talking to someone at Cigna. I want to say it was like, if not at least, I think they want over 50% of patient responsibility collected. And if they didn't see that, they would see that as justification for legal action. Now, technically, waiving deductibles and copays, there's no federal or state law that I'm aware of that addresses this situation, but it is part of your contract with the insurance providers. And so the insurance providers can then file a lawsuit against you because you're breaking your contract with them. So that's where your legal issue comes into play, is that you're breaking a contract that the insurance providers are having with you. Not only can they sue you for that, but then they can claw back all of the money they paid you since they believe you started doing that. So that's a big deal. And we've seen that happen quite a few times where we've had providers have multiple $1 million clawbacks from insurance companies, which usually ends in bankruptcy because they're not able to pay that money back. So make sure that you're always collecting patient responsibilities. And again, it's not just sending a notification saying, hey, you owe this money. Like, you legitimately have to make an honest effort to collect it. And then not only that, but you have to show that you are collecting a pretty significant portion of it for the insurance companies to not go after you from a legal standpoint. I'll skip to the Support Act, come back to commission-based pay because that's part of it. So the Support Act and ECRA is a big part of that. So that was eliminating kickbacks in the Recovery Act. A lot of it's around commission-based pay. So again, it fits into all this stuff that we're talking about, where you can't provide or incentivize free treatment. You can't incentivize other providers to send you patients for any reason, whether that's a lab or one of your own staff members. When we look at pay for admissions reps, maybe that's people on the phone. Maybe that's individuals doing outreach into the community, what a lot of providers call a business development rep. You cannot do commission-based pay with these individuals, meaning you can't pay them for referrals and you can't pay them for patients admitted into the program. I will tell you, tons of people try to get around this, and they found really, really creative and legally tenable ways to do it. So you can create really complex performance-based structures where admissions and referrals is one part of a much larger criteria, or often what's called a point system. You'll see a lot of private equity try to bring this in, oftentimes because a lot of private equity and executives really believe in the competitive nature of an outreach role. There is, let's say, a legal loophole for that. You are allowed to create an incentivization structure that has referrals or admissions be a small part of the performance-based bonus. It cannot be the only part of the bonus. Our recommendation really strongly is just to not have any commission-based pay whatsoever. You can have a standard performance review at the end of the year like you do all your other staff, but it should match what you're doing with the other staff. And you should have several levels or criteria where you're looking at it, and then they can get a very similar bonus or whatever the situation is as another staff member might get in a different role for performance. But when you get it to be outsized, when they're getting a very significant bonus, and that looks like it appears to be from admissions volume, that's when you're coming into legal concerns and legal trouble. All right, recent court cases, just to bring some of this home. FTC versus Eli Lilly. So Eli Lilly owns Prozac.com, which might not surprise a lot of people. And Prozac.com used to collect a lot of information from individuals, and they could sign up for this special like MediMessenger program that they had for a little bit. And this MediMessenger program, they decided to close down. So an individual, again, a lower level employee, similar to what happened with Cerebral, sent out a message to everyone saying, hey, we're going to close this program down. And instead of BCCing everyone or sending an individual email to each person through a mail serve client, they sent a group email to everyone and had it on CC. This obviously showed everyone who was enrolled in the program's email address to everyone else. So now we've got PHI mixed with PII. When you look at that, Eli Lilly is a multi-billion-dollar corporation. They're huge. And here you have this one little low-level employee make one mistake, and it actually only impacted, I think it was like 670 patients. Like, there's nobody enrolled in this program, or at least nobody got the email. The FTC still came down really, really hard on Eli Lilly. So that's why I talk about really being cautious from the liability standpoint. You might say, hey, that's a pretty honest mistake. Lilly employs tens of thousands of individuals, and this was one employee that made one mistake that affected a very, very, very small number of their total patient population. But the FTC didn't care. The FTC said, hey, it's your responsibility to make sure you're in HIPAA compliance, that you have safeguards in place so something like this doesn't happen. If it does happen, you're liable for it, and we're going to come after you for it. So just be aware of how serious the government takes these issues in general. Cerebral, I talked about already. They were fine for a number of things. One of the main ones was sending information to Facebook, to LinkedIn, to TikTok for retargeting and for marketing purposes. So that was a big one. They were also fined for having a really hard to find and difficult cancellation policy. like buried in their website was their ability to cancel your subscription with Cerebral. That is considered like anti-consumer practice, and so the FTC will come down on you for that. Evoke Wellness was a more recent one, so this one came out last year, right? This was one where Evoke Wellness was pretending to be other treatment providers, and we'll talk about this a little bit more in another section. This is a big concern for a lot of providers. A lot of our clients come to us and complain, and they say, hey, so-and-so mentioned our name in their ad campaign on Google Ads, or someone else is bidding on our name. You can go and bid on someone else's name. From a legal standpoint, there's no concern there. Ethically, it's a different question, but legally, if we are Evoke Wellness and we're bidding on Care and Treatment Center as a name on Google Ads, there's nothing illegal there. So what did Evoke Wellness do that got the FTC after them? Evoke Wellness was actually impersonating other treatment providers. So they were using their name in their Google Ads. They were pretending to be a generic call center or hotline when you called, so it wasn't clear who you were calling, which the FTC considers a deceptive practice. They were either directly copying website landing pages to mimic the provider they were pretending to be, or they were just like matching color schemes and making it really confusing. Again, the FTC considers that to be very deceptive practices. Now, important here too, and this actually happened with Cerebral, though they pulled back on it. They didn't just go after the organization, they went after the owners of the organization. So the officers were considered to be held directly liable for this. So it's not just the fact that they went after the business and maybe the business files for bankruptcy and closes up shop. They went after the individual owners personally and the executives personally, and they said, hey, you are responsible here. You were responsible for this company. You allowed this to happen, or you made these decisions, and we're going to come after you as well. So really, really great example, I think, of the seriousness of these issues and the fact that just having a shell company kind of protecting you is not enough legal liability in these situations to protect you against the FTC coming after you. So don't make sure that you're not copying other people's names. Also, to protect yourself, just as a heads up, you can actually trademark your name and Google will work with you. So if you don't trademark your name, if you don't have a legal record of that, Google is usually not going to do too much. But if you have it trademarked, then that means that no one else is allowed to use your name in their advertising. So if another organization says, let's say Karen again, just because it's a really well-known name, and if you have an ad that says, looking for Karen, call us instead. Now, technically, again, there's nothing legal there. You're not impersonating anyone. You're kind of making it clear that, hey, we know you're looking for this provider, but we also offer similar services. That there's not a legal issue there because it's not overly deceptive. Again, ethical questions, sure. Legal issues, no. Right? Where did Evoke get nailed? Because they were actually illegally impersonating other providers. They said, hey, we are Karen, or here's our landing page. It looks exactly like Karen's. That's where they got issues. So you could technically say, looking for Karen, call us instead. They can't do that if you have your name trademarked. And Google will pull it down. So if you email Google and say, hey, we're having this issue. If you have issues with that, you can contact me directly. I have contacts to expedite that process and make sure it gets in front of the right people. And so that can help there if you're having issues with it. But if you trademark your name, you're able to at least combat those issues. Now, it's a game of whack-a-mole. They're going to shut the ad down, then open it up somewhere else. And so you have to constantly be doing it. But it is an option that's available to you. All right, New Jersey investigations into Banyan Sanctuary and Kingsway. So just a heads up, this is still partly ongoing and there were concerns brought into play, but as of the time of this, there was no charges actually filed. What was happening here is we already talked about that you can't pay for flights for patients, for example. That's an incentivization. It's considered a kickback. What some providers were doing is they were creating kind of third-party relationships through nonprofits. So you might have a nonprofit entity, and the nonprofit entity would buy the plane ticket for the patient looking for treatment. So the provider would talk to the patient and then say, hey, let me talk to this nonprofit over here, and then we'll see if we can get that paid for. That is considered a major concern by New Jersey. Other states will be following suit. I'm sure the federal government will eventually follow suit. So this was just a really good example case to be aware of. Another thing that was happening is that there was donations going back and forth, right? So there seemed to be an equivalent number of patients that were being referred by certain nonprofits then there would be a fairly equal number of donations heading the way of the nonprofit. So there was this reciprocal relationship that was called into question in New Jersey. And then the last one I want to talk about is the Meta class action lawsuit. This actually goes back to the pixel data that we were talking about. And so this is where you saw Meta, Facebook, and Google start not allowing pixels on the website for retargeting purposes because Human Health Services and the FTC started to have concerns around that. Now, the final determination here went back to that authorized versus unauthorized. So if it's an authorized login where they have a login portal, then that creates an immediate concern. If it's not a login portal, then it's a little bit more of a gray area, but we still obviously recommend that people do not put pixels on the website. Ethical considerations. So again, these aren't legal issues. These are things that you can do in most states, but other providers are probably going to look down on you for it or have concerns if you are engaging in these behaviors. One of them is conquest marketing. So conquest marketing is the act of bidding on a competitor's name. And you'll see this across the web in a lot of business lines. Like if you look for Walmart e-commerce, Amazon's usually going to have advertisements that pop up, and vice versa. If you look for Amazon, then Walmart might pop up. Dick's bids on Cabarrus bids on Dick's, et cetera, et cetera. This is really common in the marketing world. There's really not considered to be concerns with it in most other verticals. It might annoy people, but it's not considered a big deal. In the healthcare space, it is considered a much larger deal, right? Because it just appears a little bit more deceptive. Again, if I'm looking for care and treatment centers because that's where I want to send my loved one, and I've got someone else bidding on my name, especially if they're mentioning my name in it, right? Hey, like looking for Karen, why don't you call us instead? That's really upsetting to a lot of providers. Now, again, there's nothing illegal there. They're not breaking any terms of service of Google. There's no laws in place that prevent you from doing something like that. But it is definitely going to raise questions about your willingness to kind of be deceptive or underhanded in your marketing tactics, which is going to impact your reputation as a provider. So that's called conquest marketing, is bidding on another competitor's name. Third-party call centers is one that isn't illegal, except potentially in Florida. So Florida has a law that you have to either be the caller or be the treatment center that's actually responding to the call, or you have to be registered with the state to be able to do this. Every other state in the country that I'm aware of doesn't have this law, but Florida had so many issues with it with these third-party call centers. And even for the third-party call center, they still have to be very clear in who they refer to, why they refer, et cetera, et cetera. So we strongly recommend against using third-party call centers. You should be representing your own program. You should be running marketing to your own program. You shouldn't be outsourcing that to a third party in terms of handling it, because that third party, you don't know what they're doing. You don't know what they're messaging out there. How are they generating those calls in the first place? A lot of times historically, unfortunately, in behavioral health, there have been a lot of deceptive marketing practices. This is where a lot of our problems came in this field originally, was a lot of third parties that were just doing whatever they wanted to generate a call. And then they would have these contracts or have these referral relationships. So again, you can't pay for patients. You can't pay for referrals. You can technically pay per call. So that's not illegal, but it is, again, a large ethical concern. Why are we paying per call? Why aren't you running your own call center with your own staff? Now, you can have a third-party agency market for you, but they need to be marketing under your accounts and your brand name. So you can hire an agency to run your Facebook ads, to run your Google ads, to do your search engine optimization for you. But what shouldn't be happening is an agency that's running generic ads to their own websites or using their own Facebook account to generate calls that they then maybe send your way. Like, they need to be taking your profile, sending patients to your website so that the patients, when they call you, and people that actually work for you. That's really important from a call center standpoint. Accurate communication, it's going back to what happened with the woke wellness, and unfortunately something we've seen that's not uncommon within the space. You should be very clear, accurate, and transparent about who you are, what services you're offering, et cetera, et cetera. When it comes down to it from an ethical standpoint, we want to do what's best for the patient. Is it best for the patient if they don't know who they're calling? No. Is it best for the patient if they're being referred to some other provider that's paying for the calls and paying per call? versus that person being referred because they know that this organization is the best fit for that particular patient. We want to always look at what's best for the patient, and that should determine what choices we're making from an outreach and a marketing standpoint. And that should be the bottom line in our perspective. Quick review on this. So can we pay outreach reps based on commission? No, that is illegal. It violates ECRA. And so you cannot pay reps based on referrals or commissions. And now, are there ways to kind of find loopholes in this with point systems or changing job titles? And we've seen some pretty creative things at the end of the day. Yes, technically you can do those, but we strongly recommend against it because the FTC or other regulators can look at the spirit of the law in addition to the letter of the law and absolutely find fault with that. Also, from our perspective, who do you want working for you? You want people that really care about your mission. Do you really want someone that's driven purely from a financial standpoint to be your primary point of contact and your first point of contact with your facility? From our perspective, no. We'd much rather have someone that's on a salary that really cares about what they do and is mission driven versus someone that's focused on making as much money as possible, being the one representing your program. So we strongly recommend just flat salaries with a traditional performance review at the end of the year, like other staff. Can we install tracking analytics on our website? So remember, this is a mixed question. You can, but if you have an authorized website, meaning that they're logging in somewhere, then you absolutely should not. Can we offer free services to attract patients? No. Particularly if you are taking any kind of federal insurance, including military insurance like TRICARE. Can we waive deductibles and copays? Technically, this isn't illegal, but it will absolutely get you in hot water with your insurance contracts, and they can come after you legally for breaking that contract, as well as clawing back any payments that they made when you were engaging in actions that broke the contract. Can we cover travel costs? So we can't cover flights. That was made specifically illegal within the behavioral health space, in particular with the Support Act. You can go and pick people up. You can still drive people. There are actually a number of programs that allow you to pay for an Uber if it's not too far. There are even federally funded programs that will pay for an Uber for people on Medicaid or Medicare. So driving is largely not a concern. It's really the flight tickets in particular that are considered a no-no. Can we target competitor names on Google? Again, you can. There's nothing illegal here, but there are certainly ethical concerns and question marks around doing that, as long as you are transparent in the fact that you are not trying to deceive people and pretend to be a provider that you're not. It's something you can do, but strongly recommend against it. And then, can we use third-party agencies? So you can use call centers in most states. We don't recommend it for all the ethical reasons that we talked about, but it's not illegal, except in Florida, where they have to be registered with the state to be able to provide those services. Can you use third-party marketing agencies? Yes, there's no problem with using a marketing agency. Again, as long as they are using your accounts and marketing you and sending calls to you, not to some generic website where they then transfer the calls to whoever they want. Like, that's not the way that you should be doing it. So that's it. That is our overview of legal and ethical practices from a marketing and outreach standpoint. From there, I know we've had a couple questions come in, so we got about 15 minutes here to answer those.
Catherine asked, many, especially rural areas, have limited services. Many people with SUDs have blown up their finances and family relationships. I get the reason for the laws banning such, but suggestions for workaround on travel.
Yeah, it's a question that comes up quite a bit. And there are a number of honest providers that's why they were paying for flights. And that's why they work with nonprofits. So those are some of your options. You can actually work with a nonprofit. Some providers will actively seek out those relationships. Not so it's like a direct referral relationship, but in genuine need, they have patients that have those concerns. You can look at sliding scales. There are ways to do sliding scales. You can actually technically provide free or scholarship treatment if patients meet certainly federally mandated criteria. So you should work with legal counsel on that, and they can say, here are the questions that you need to ask. You'll need to get a credit history report. You'll usually have to get some additional background from the patient, and if they qualify, then you can use that to potentially waive a fee or deductible or provide some additional transport services. And then, as I mentioned, driving's usually not a concern. So if you want to provide transport, I have never seen any case or any concern even from a legal standpoint in terms of driving people. We have providers, even Medicaid providers, which is a lot of what you have in the rural areas, where they're driving 3-4 hours to pick someone up, one way. So that's a 6 to an 8 hour round trip drive. And that has been not an issue. It's just paying for the flights that becomes a concern. So if you can figure out a way to do driving, if they're in a reasonable distance, and most patients are, right? Especially if you're in a rural area, you're driving in that community, in that county, right? Maybe the next county next door, but you're not flying people from across the country. So you can absolutely drive people. And then look into those federally funded programs. Medicaid, Medicare will often provide transport. There are ways to do that as well.
I have a question that I forwarded you a couple days ago that you may not have seen yet that's related. Someone had asked, there are several advertising websites such as rehabs.org, Sober Centers of America, and Detox, who are using their website images and marketing their services. Some of the information is correct, but some's not. Additionally, they may have their listing numbers that sometimes direct to the facility, but often direct to their own services. Is there a way to keep those advertising websites from providing incorrect information, or what can they do to kind of get that to stop?
Yeah, that's a great question. There are tons of these websites, and lots of providers used to run unbranded websites. Now, most of the time, you'll see them branded because they cannot get legit script certified otherwise. And if they're not legit script certified, they can't advertise on Google, they can't advertise on Facebook, they can't advertise on Bing. So the vast majority of providers are very incentivized to make sure that any websites they own are clearly branded with their name on it, and they know who is calling. You'll often find like a who are you calling or who answers the phone. And usually that's very clear on these websites these days. But there still are some providers that, try to run it underground and all that kind of crap. There's nothing illegal there. Unfortunately, it's not a legal issue. It's mainly an ethical issue in those regards. If you see an operator that has their name branded on it, usually what you'll see these days is, because the only way they can get it legit script certified is the information has to be accurate on the site. So if you go to your provider name's profile or location on their website and you see an inaccuracy, you should be able to email that provider specifically, who answers the phone. You can call in, you can send an email in. There should be a contact information in there and request that they update it for you. If they don't, then I would submit that information to the legit script and say, hey, look, we've got this provider that has our inaccurate information on here. We have some concerns. If they get an email from legit script, they're probably going to take immediate action on it. With that said, again, there's no legal responsibility for them to do that. If they got inaccurate information, they've got inaccurate information, but they're not being deceptive in terms of the issue would be from the FTC standpoint. If they said that they had your name of your treatment center and the phone number actually called them, and then they pretended to be you, those are two deceptive practices that would be legally actionable. But if they have your number or what they think is your number, even if it's wrong, and then maybe at the top of the website it has their number, that's perfectly legal.
And then I'm just I know that when I forwarded it to our CEO Pete Nielsen, he did say that California does have a bill that has basically made that not quite legal, and other states are starting to follow that lead. So hopefully advocacy efforts will get that changed.
Yeah, that'd be great. I always tell people not to worry about it. I know they get really upset by it and it's really frustrating, but you can spend all day trying to email people and send cease and desist and stuff like that. And because there's not a strong legal framework around it, you're not going to get much action. Also, I can just tell you for a fact from a marketing side, almost all of those websites don't get much traffic anymore. They used to. So it was a strategy that a lot of people were using for various reasons. But the way that the Google algorithm works these days is they really tie everything to your local Google My Business profile. That drives your local rankings. It's very hard to rank nationally. It's very hard to rank for someone else's brand name, things like that. So for those reasons, we just don't see it as a large concern. You definitely will have some people that call the wrong place or get tripped up with that kind of stuff. But the vast majority of people find you if they're looking for you. And so it's best to focus on what you can control. The last thing I would mention is there are a bunch of providers still out there too, like recovery.org, where that's their business model is they basically provide elevated listings. And that's actually a really common business. I mean, Angie's List is that, Thumbtack is that. That's how these businesses operate. So it's a very common legal business model within the US. And you will go and create a profile. Even Yelp is technically like that, right? If you pay for a Yelp profile, they will build out your profile, make it better. So just be aware that even though it might be annoying and frustrating in the healthcare space, it's a fairly common model across the country, and generally doesn't have too many legal concerns unless something like California comes across. So like I said, our advice is just to ignore it, focus on what you can do, which is good marketing. And 99% of the time, if you're running good marketing, that stuff's not going to show up. Your stuff's going to show up first anyway.
Well, and speaking of which, NBHAP does have something kind of like that with our locatetreatment.com website. It's basically a listing of, you can create an account and all that, but we have a NBHAP badge that if you're a member, you get set to it. So it does say that, that basically implies that you follow our code of ethics, that you do follow ethical rules, that kind of thing. So we make sure that is an option. So for anyone who might be interested.
This is like, a lot of organizations do it. Like I said, like NATAP has a list of all the providers, and that shows a little bit more trust, so it's pretty common.
Any other questions? Going once, going twice. Sold. I want to thank Nick Jaworski for presenting today. Thanks as well to you for participating. While this webinar does not provide CEs, it is eligible towards the requirement for renewing the CATM/CAMS, a comprehensive program of 6 courses. The CATM is a first of its kind certificate program that teaches you best practices and practical tips from renowned legal and industry experts. It is completely online. We hope you join us for future NBHAP webinars. You can sign up for our various newsletters, which include emails specific to upcoming events, at our website, www.nbhap.org. This concludes today's webinar. Thanks again.